Dear fish hobbyist, dear aquarist, today already my case number 60. Yes, 60. That's why I have a nice background of snow paradise in the winter time. No, I'm not sitting outside. I prefer to be inside, but it's nice to have a beautiful nature around us. It's like why we're keeping our fish in an aquarium to have a beautiful part of nature inside the house with some plants, with some beautiful fish, and that we enjoy. But we don't enjoy the problems we can have with a fish. And that's why I try to give you these lessons. So you have all those cases already 60 that tells you, well, what kind of diseases can occur on our fish. And today we have a special one. It's the holes in scales caused by an amoeba infection in the Platy rainbow. An amoeba is determined as a kind of parasite bacteria. There is still systematically no definite conclusion by the experts, but you can call it a bacteria or a parasite anyway. It's something that is causing a problem, and I will show you in my observations what we can do or what we can see. The first thing we can see is this bunch of platies here, platy rainbow. See how they're scratching at the bottom of the aquarium. See how nervous they are, scratching, itching. Something is bothering them. Not all of them. Some are hanging there, but you can see the behavior of those platy are not normal. This is not what a fish should do. A healthy fish doesn't do it. Doesn't hang like this. Doesn't lay on the bottom. So the fish were suffering. Here we have more details. See the clamping of the finch also. The fish are fraying, clamping, not acting perfectly. And then, of course, that scratching is something that you think, well, there is something on the skin, or maybe the gill, bothering that fish. And the fish gives you a lesson. It teaches you, hey, it gives you a signal, gives you talks to you with showing this language. And that is your time to take action and to take a microscope. And to show you on this scale of the fish scale, I show you the holes here. Here is a hole, there is a hole, here is a hole, and here is another. There are 4 holes on this scale. And you find that on many different scales of the fish, you see those holes, and that's not normal. They should not be there. And there's also tunnels made in there. And that's all caused here, also here, and here, and there's also here. So there are different holes in the scales, and that's causing like a lesion. And you can find sometimes on the bottom of the aquarium scales back, which drop off because it's caused by a protozoa. Yeah, some people call it the protozoa amoeba, which I show here in a specific microscope. We can hardly see it with our microscopes, to be honest. I've been checking to check it in here. Sometimes you see something moving inside, but that's hard to see. I'm sorry, it's difficult to see. But the holes, you should not see it. And we see it quite often in some platies from certain suppliers, particularly from Asia. But we also found on this platy rainbow that there was a lot of fatty deposit, fatty tissue between the organs or on the organs. And that should not be there. That means there has been a bad feeding practice, because the fatty organs is usually caused by not good feeding quality, poor proteins and poor herbs and poor algae, not adequate feeding. That's a problem. So holes caused by an amoeba, not detectable with any common microscope. Try to treat as soon as possible to avoid serious damage and losses. We recommend to use formalin malachite green or methylene blue. That's the formula FMC that you find back in my books on fish diseases, or a similar medication on that formula. There is quite some available in the pet shops. Improve the immune system of the fish, because you can see also the fatty tissues inside the organs. Adjusted feeding with pro and prebiotica, that also helps to make the fish strong and in developing better immune system with our Biofish Food Forte or our bioprofessional care. So the day after the treatment of the FMC, you could notice already here that the behavior of the platies is much better. It's quite normal. And you can see the coloration of the water due to the FMC. So you can see the difference the day before and the day after, how better those platies are behaving. And there's hardly any scratching going on. So that's how within 24 hours, how quickly you can have a result. So checking on fish diseases is in many cases using a microscope. And this gives you the idea what eventually you can treat instead of guessing. So if you follow all my cases, and this was already case 61, you'll be well informed about how to take care about your fish. Thank you for watching.